Good evening and thank you for joining us for KREM 2 News at 6. I'm Mark Handrahan.
Welcome everyone, I'm Whitney Ward. We begin tonight as face masks are once again required in North Idaho. And this time it's not just in Kootenai County, but all across the entire Panhandle Health District.
Voted to rescind the mask mandate last month. Let's get right to KREM 2's Taylor Vito, who's been tracking this story all day. He brings us the very latest tonight from Kootenai County.
Well, yeah, Mark, it's been a little bit of a roller coaster ride in terms of the mask mandate and Panhandle Health's board. But on a 4-2 vote this afternoon, they opted to bring the mandate back, but with a big change. More on that in a moment. But during the meeting today, some spoke about the rising case numbers here, while others who were against the mandate questioned COVID-19 data and if a mandate was the right thing to do.
It means a tidal wave is coming. That prediction is based on the data.
That was the voice of Panhandle Health Board member Jay Nelson as she made a pitch for a widespread mask mandate to come back to North Idaho. Health experts have said that the coronavirus positivity rate across the Panhandle Health District, which encompasses the 5 northern counties, is over 17% and is rising. Kootenai Health has previously said that their employees are strained and they're concerned about hitting capacity. Like before, the mandate discussion brought some debate. Protesters could be heard chanting outside of the meeting. Other board members who opposed the mandate questioned COVID-19 data and if a mask mandate was morally right.
Jay, it sounds like a lot of good scare tactics, but I disagree with the mandate saying you will under penalty of law. That to me is totally wrong.
In a reversal from last month, the mandate eventually passed on a 4-2 vote. The new mandate, as proposed by Nelson, now applies to all of the Panhandle Health District, not just Kootenai County like before.
It's our job to provide courageous and steadfast leadership in a public health crisis. It's our job to save lives.
The mask mandate situation was somewhat scattered before in North Idaho. Coeur d'Alene, Wallace, and Kellogg all had mask requirements. The city of Post Falls recommended that people wear masks, but only required them on city property. To the south, in the North Central Health District, Moscow requires face masks as well.
Now, like before, the mask mandate is technically a misdemeanor, so if you break it, there could potentially be some penalties. But it's worth noting that authorities across North Idaho have mentioned throughout this whole pandemic that they're taking an education before citation approach and that they're trying to just educate people rather than handing out tickets just right out of the gate, so to speak. And it is worth pointing out that any kind of citations in North Idaho related to anything COVID-19 have been pretty rare. In Kootenai County, Taylor Vito, KREM 2 News.
And in the meantime, 4 people who violated the Coeur d'Alene mask mandate will not be cited. That's according to the city's chief criminal deputy. He says prosecution was declined because no warning and no opportunity to comply with the mask mandate was given to the people involved. The city attorney's office will now have the final say on those citations. Violating the mask mandate is subject to a $100 fine.
All right, let's take a look at the latest numbers as we continue to track the coronavirus spread in our communities. Panhandle Health is now reporting 189 new cases today, as well as 3 new deaths. In total, 97 people have died in North Idaho from COVID-19. 4 new hospitalizations just today for a total of 62. In total, more than 8,200 cases have been confirmed since the start of this pandemic in North Idaho.
Meantime, in Spokane County, 414 new coronavirus cases were reported today. That is our second biggest single-day spike. 4 new deaths were also reported. 120 current hospitalizations, 90 of which are Spokane County residents. More than 13,800 cases to date since the start of the pandemic. The county recovery rate right now stands at about 65%.
And as those hospitalizations continue to surge, hospitals are working overtime just to make sure they have enough capacity to care for all of these patients. I had a chance to sit down today and talk with the program manager of the Sacred Heart Special Pathogens Unit. As you know, Spokane is the only one in the region with that kind of highly specialized unit for contagious patients.
It's been really challenging. It's been very tiring. In my 30-plus year career in healthcare and caring for patients, it's like nothing I've seen before.
What do you see from the inside as kind of that emotional toll on these healthcare workers that are there day in and day out?
Yeah, it's complex care. And so caring for people in that level of isolation, in that amount of PPE, and then you throw in the complexities of patients and caregivers not being able to have that direct person-to-person interaction with families. It just, all of those things layer and on top of each other, and it's just tiring.
Do you think here in Spokane that we are better positioned because of this special pathogens unit?
I certainly believe, yes, I believe we have a level of expertise and training and education. That space has been a very useful resource. So, we've learned a tremendous amount about this pathogen from February when we started down this journey to where we are today. And we have continued to use that space as it has specialized air handling system.
At the beginning of all of this, that the main goal was to try to keep that curve as flat as possible so that it wouldn't overwhelm the healthcare system. Are you worried about actually reaching capacity to where we are starting to overwhelm the local system?
We're always looking at our capacity and looking at those numbers and anticipating of all the what ifs.
So it's not something that is just out there like, oh, that'll never happen, we'll never get there. It's a reality that you guys are faced with and are absolutely planning for.
Absolutely.
Do you ever just walk around and just kind of look at what healthcare has become and what the hospitals are like right now and be like, this is it. This is exactly what we've trained for?
Yes, we've had many moments like that. And sometimes we just sit back and go, wow, look at all of that training and education and how well that paid off and the processes we had to be able to respond well to this pandemic.
Do you ever have fear going to work, being surrounded by this virus?
No, I don't feel fearful. I feel confident in our practices, in our processes, in our infection prevention practices, and I have a tremendous amount of confidence in our healthcare team.
So when you hear people outside saying, no, I won't wear a mask, no, this virus is a hoax, or we are way overreacting, what do you need those people to understand right now?
I need them to understand that this virus is real. And it is challenging and it is complex. And so people are sick. I need people to understand that they have the power within themselves to decrease the spread of this virus by following that public health guidance. That's really the best way our community can support our healthcare workers and show their appreciation and gratitude for the hard work everybody's putting in on the front lines.
All right, we want to switch gears and talk weather now. The clouds have made their way into the inland northwest this evening, but we did see some sunshine earlier today. Tom Sherry, you're always looking ahead to the weekend, and it is Thursday night. What's in store, my friend?
I think we've got sunshine on the way as soon as tomorrow and again on Saturday. Mostly sunny skies, that is, so some drier weather. It's cooling off quite a bit right now, and you can see with the wind out of the southwest at 13 miles an hour, I can feel it. And it makes that 38 degrees that I'm showing you right there feel even cooler right now. We're going to drop down below freezing temperatures. And we did have some snow showers that have been moving across I-90 and then mostly into Shoshone County, but also little portions of eastern Kootenai County. And again, you can see the snow now beginning to move off into areas of western Montana. But generally speaking, east of the Cascades, it's been relatively dry. We'll look for temperatures to drop down to 31 degrees overnight. And then I'm looking for mostly sunny skies on your Friday with a daytime high of 45. I think it will start off cloudy and then by mid-morning hours become mostly sunny. And so I'm tracking dry weather there. Chance of some snow showers, though, east of us into areas of northern Idaho, mostly the mountainous areas and mostly early in the morning. And again, as Mark said, I'm always looking ahead to the weekend. At least I'm consistent on that. I've got sunshine on Saturday, increasing clouds on Sunday. By Sunday night, we could see a few showers develop. We'll look for daytime highs in the low 40s, overnight lows in the upper 20s. I'll track that 10-day outlook for you coming up in a few minutes.
Looking forward to that, Tom. Thank you very much. Meantime, our local ski resorts are already starting to see some snow.
Absolutely, and that of course means winter inching closer and closer to the inland northwest. And with a La Nina winter in sight, the big question is how much snow can we expect to get this winter? Next, Tom Sherry is back to break that down. He's got his extended winter forecast.
Come on, come together and give us small businesses some help.
And as new restrictions roll out statewide, some businesses fear they'll have to close for good.